My name is Dr. Monica Potter, consultant child and adolescent psychiatrist. The majority of cases come through the outpatient route to the community treatment. So from the point at which we refer from the GP, we would see the family and meet them in the outpatient clinic and start off by getting to know who's in the family. We'd obviously need to get a history of what has gone on, a history of how rapid the weight loss has been, over what period of time the weight loss has been. And a key part of the first meeting would be to get a weight. Very occasionally, if a young person is critically medically unwell, they may go straight to the children's hospital, but majority will come through the outpatient route. And from that first meeting, depending on the physical state of the young person, if they didn't need to be admitted to hospital, we'd arrange to meet them again in a week's time. I think it's important to be clear that there isn't a fixed route, and for each young person it will be slightly different. Their experience will be different, the family's context will be different. But our aim is for the young person to be able to get on with their lives in a way that isn't disrupted or disturbed. Their thoughts aren't interfered with by the anorexic type of thinking. Obviously the parent's key in the refeeding process to get weight restoration on the way. That first stage could take 3 or 4 months really. The second phase will be helping them to take the responsibility back for their eating, and with that the parents will have to start to give more trust to them, help them experiment going out for a meal with their friends, and that often comes at a later stage. The psychological recovery, we know, is a lot harder than the weight restoration, and if, for example, there isn't any progress after a period of sessions, then we may consider more intensive treatment from the local adolescent unit, the Riverside Adolescent unit, a shared approach really to ensure that the young person's needs are best met.